Dr. Kağan,
Yes, yes.
thank you
I'm
for your
Kağan
time.
root canal treatment specialist, endodontist.
Perfect.
Yes.
So what I would like to talk with you about today is about your specialization. It means root canal. Why we are doing the root canal? What's the main issue people have when we are talking about this kind of treatment? If you can refer from your experience, will be great.
Yes, of course. Inside the tooth, middle of the tooth, there is pulp chamber. So that pulp chamber have nerves and blood cells. Okay. So that if the pulp chamber damaged or infected, we need to do root canal treatment. Okay.
Yes.
So the pulp chamber damaged by trauma, caries like this, so got inflamed. So if the patient have an inflammation in the pulp chamber, have a pain, and we need to do root canal treatment.
So let me ask you very specifically, what are the symptoms that I need a root canal treatment?
Pain, first, severe pain, okay? Because tooth pain is very hard to take, okay? So if you have too much pain,
Yes.
but the pain when? It is the question we are asking the patient. When you sleep or you are not drink or eat anything, if you have a pain, that means you need root canal treatment.
Okay.
When you drink cold or hot water or something, you have pain. It's more like just feeling, not root canal treatment.
Okay.
Okay, and pain and swelling. If you have a swelling, you need root canal treatment.
So we can say
Pain and swelling.
yeah, pain and being swollen also like the harsh pain.
Yes,
Not
harsh
not
pain.
not the normal one.
Not the pain with the the outside thing with the food or drink.
So
The pain,
independent one.
yeah,
Just going all the time.
the pain long one, and you have all the time.
Okay, that's great. So, and also the other situation when we are doing root canal treatment is when we are shaping the teeth for
Yes.
for the crowns, right?
Yes, the prosthodontist shaping the teeth. After the shaping the teeth, sometimes nerves coming close to surface too much. So it's very risky. After we put the permanent crown and you go back your country, it's very risky for the pain. Okay. So if the nerves coming close to surface too much, we need to do it for the protection actually. Okay.
So when we are shaping the tooth, we are going too close to the nerves.
Yes.
So as you are saying, there is a risk that when we will put the crown, it start to have the pain.
Pain and sensitivity. Too much sensitivity.
So are you like that's very honest question.
Yes.
Are you capable to recognize 100% cases where or when the teeth need the root canal in this situation? Or there are situations where the patient is going back and he has the pain?
No, of course, 100%. No, of course. In health sector, there is no 100%
Okay.
for anything. Okay, but we can decide which teeth need root canal treatment with many ways.
Okay.
So we are using that diagnosis ways, and we can decide like this. Maybe like 90%, 95%, we can truly decide and do the root canal treatment.
Okay. But in the situation when it's happening, like the crown is placed and the patient start to have those symptoms that something is wrong, the solution is we are taking out the crown and we are doing the root canal and placing it again. Is it possible?
It is the one way. It is the one way. And we can do it over the crown, okay? So not taking out the crown.
Okay.
Just open the access cavity for the root canal treatment over the crown, and we can reach the root canal and do the root canal treatment.
Okay, so it sounds like it's not very complicated,
It's
actually.
not very complicated for the specialist, of course.
That's why, I have this experience, or more, I heard different stuff. And for example, I'm Polish, so Polish dentists, they are saying, oh, people from Turkey, they're coming back, they have the teeth sensitivity, and they're demonized it. Like they're making a big issue from that. And as you're saying, it's a normal stuff somehow.
Somehow, yes, but we want to catch it here.
Of course.
If you have a risk of sensitivity, we want to catch it. Of course, we catch first time here like 90%, 95%. But sometimes the patients have a sensitive problem or pain problem when they go back their country.
But it means like it's happened for all the dentists. It's not only here, like you have 95%
Yeah.
of the, correction when with the root canal. When someone is doing this procedure in his home country,
Yes, of course.
he
Yes,
will have
of course.
the same statistic.
Same, yes.
So the solution is there. So the
Yes.
only thing you need to do actually, when you start to have some issues, you need to contact your clinic, and the
Yes.
clinic is referring what you should do to fix the problem.
Fix the
That's
problem.
it.
Yes.
So
Yes,
actually,
that's
it's
it.
not a problem. It's
It's
normal,
not a big
normal
problem.
thing.
Yes, normal
happening.
thing. Normal thing. And don't forget that the too many patients coming here for all the smile design. You know,
Yes.
all the 28 teeth gonna be crowned. So that means too much tooth. Okay. So when you go back your country, maybe one teeth doing a little bit pain. Of course, that's not the biggest thing. Yeah. If you have the same treatment in your country, it's same, of course.
Exactly. But we need to be aware of that because, it's just like I'm sure you're informing the patients about that.
Yes.
But some clinics, they're hiding some things to look more like professional, or I don't know. But what our goal is to say things as they are. So I really
Yes.
appreciate what you're saying, because it's very, very needed for the people to know. So are there any other situations where the patient need to have like intervention in his home country, or this is the only one which can happen after having a
Yes, because of the crown, sometimes crown can be broken. Yes, because of the crown, sometimes they need more treatment like this.
Okay, so we can say just you can count on one hand,
Yes.
even 1, 2 actually
One,
some
two,
situation.
not that much problem, but always they can come back here. So generally we are solving the problems. Yes.
Yeah. So if there is a problem, there is always post service.
Service, yes, always, and there is always, nearly always, there is solves for the problem.
Okay, that
Yeah.
sounds great. So
Yeah.
it means that apart from being flexible and to have the awareness about what can happen, which not always happening,
Yes.
you're completely covered, and always you can ask for.
Always we can cover it.
Yes.
But as I said, we want to do it nearly perfect in the first time.
Of course, as good as
Of course.
possible.
As good as possible.
Yeah.
We want to catch all the problems at the first time. But if you have a problem again, and it can be, you can have a treatment in your country or here. There is same possibility you have the problem, so we can cover it. Of course, if you come back here and you can show us the problem, and we can solve it nearly all the time.
Okay.
Yeah.
The worst case you had in your practice?
Worst case, root canal treatments, actually, I'm doing the root canal treatment with the patient, actually. If the patient can't open the mouth consistently, that's a problem for me, you know. We are doing...
You don't have something like a stent?
Yes, but it's very uncomfortable for the patient.
Okay.
Very uncomfortable for the patient. So if the patient stay through all the root canal treatments perfect, it's okay for me. I can do everything. But the patient, if a little bit, scary, a little bit, can't open the mouth, it's a little bit hard for me. But okay, we can do it too.
Are you doing your procedure with the microscope?
We can. I'm using the loop, okay, if the necessary here. But in general, I'm not using the loop or microscope. If there is hard there is hard to do root canal treatments, root canals. Of course, I'm using the loop.
So we can say your experience is some kind of advanced enough. So most of the cases, you're just using your experience as a referral.
Yes.
But you perfectly know when to use the other tools to do your work as good as possible.
Yes. Sometimes, everybody have a different genetics for the root canals. So sometimes the root canals very hard to do for the treatment. So if there is a root canal like this, of course we need to use more equipment to solve the problem.
Okay.
And I wanna say something more. It's all about the practice. In Turkey, the root canal treatment specialist doing maybe 30, 40 root canals, maybe more root canal treatments in a week. So in USA or Europe, the root canal treatment specialist doing maybe just 5 or 6 root canal treatments in a month. That is big difference for the...
Okay,
Yes,
definitely.
that's big difference. So it's all about the practice. We are using our hands, and
so we can say like your 5 years of work is like 25 in other
absolutely
in other countries
in
somehow.
Europe or USA.
Okay.
Yeah.
And what is the most advanced, let's say, method or tool you're using to root canal treatment today?
Today, we're using the endomotor. That that motor using with the files, working with the files. So, and we using the solutions for the cleaning the root canal, and sometimes we need to activate the solution with the another motor. Okay, and we are using the modern filling materials for the root canal. It's very different than the 5 years ago.
Okay.
Okay. Like this, we always catch the day, and we're using all the modern technologies. Yes.
So we can say you are using one of the most modern tools and solutions on the market, or you're somehow backwards?
Yeah, no. We are using that all modern solutions, materials, filling materials, and motors for the files. I think so.
Okay, great. Thanks a lot.
Thanks a lot too.
Thank you. Thank you.